Hello and welcome to Voices of More, a candid space for real talk about living with breast cancer. I'm Amy Robach. I'm a mother, a journalist, and an early breast cancer survivor, and your More respondent. Here we aim to create a space where nothing is left off the table. These are the voices of women with raw, honest stories to share, not just about their diagnosis, but the realities faced after diagnosis. These are the vital conversations because they offer a connection that makes us feel a little less alone. In this episode, we will talk about what it means to take control after an early breast cancer diagnosis. Because after diagnosis, perspectives shift, and learning how to live through that shift takes perseverance and strength. The truth is, breast cancer can appear even when it's unexpected. 90% of breast cancer patients do not have a family history. I didn't, and neither did my friend Nikki here, who will help shed some light on this vital topic. Nikki, welcome. It's so nice to meet you. Thank you for joining us today.
Of course, I'm happy to be here. Nice to meet you too.
So before we dive into your journey with breast cancer, can you tell me a little bit about who you are?
Of course. I'm from Tennessee, born and raised. I have two boys, husband of almost 25 years, and we play baseball. We love sports.
You're a sports person.
I am a sports person.
Through and through. We can connect on that.
Absolutely.
Where are you right now in your early breast cancer journey?
Right now, I'm just living my life, doing the best I can every day and enjoying my family.
What's been more emotionally complicated than you expected it to be going through this journey?
I think for myself, the aftermath, living through it, I was able to continue to push through, and now it's picking the pieces up now. It has been the roughest part for me.
It's waiting for the other shoe to drop.
Absolutely.
Because you already got an unexpected diagnosis, and so you think to yourself, it could happen again. And we go through something that many breast cancer patients and probably cancer patients all around call scanxiety. When you have your next blood test or your next scan, that fear of what if it comes back. You actually had a real life scare.
I did. Just about 3 months ago, I sure did. And luckily everything came back okay, but the fear of that flooded right back to day one. And I live with it every day still. So yes, it is a real thing.
I've always described when you go back for your routine check, you feel like you're getting a thumbs up or a thumbs down. And really those 24 hours or however long you have to wait to see if they found something is torture. It's anxiety leading up to the test and anxiety waiting for the results. I know we all have to dig deep and do it for ourselves, but it certainly helps when you have friends, family, even breast cancer survivors, that community help you get through some of those low moments. Who has been that and been there for you?
So obviously your family is your rock. We're fortunate enough to have an extended family with baseball families. My husband has coached both of our boys and coaches my youngest now, and that family that we have made is extraordinary. And I lean on them every day. My sister, my mom and dad, you know, those people become your everyday people. And my circle is very tight with who's in there.
Yeah, I found my circle, it got larger in some ways, but in other ways it got smaller.
Absolutely.
Because they're the people you trust with your lowest moments and your deepest fears. I know sometimes a win when you're going through treatment and even post-treatment, it's just getting up and doing one thing that you're proud of. And I know it's oftentimes just managing, living with the fear of recurrence and trying to be present in the moment. How do you keep the fear at bay?
I've always had a really good work ethic, and I try to continuously push through with my diagnosis, with my treatment, with everything that I've done throughout my life. And I attribute that all to work and showing up for myself.
Having a purpose.
Absolutely.
That really matters. It matters to be something other than a breast cancer patient.
Absolutely.
Because you do get defined by it in moments. And so it's so important to have that other piece of you, that actual piece of you that has nothing to do with being a patient.
Absolutely. I couldn't agree more.
Unfortunately, women are being diagnosed every moment with breast cancer. What would you tell someone who's been diagnosed with breast cancer, early stage breast cancer?
It's 90% attitude and 10% cancer.
We all emerge different and I think we both believe better from a breast cancer diagnosis. Was there a version of yourself that you uncovered, that you found, that you recognize now as more than you thought you were?
Absolutely. I found my creative side. I got into wreath making. I got into doing my own nails. I found that I could just do more and not have the backlash of anything. It was just being present, living in the moment. Do it for yourself, do it for everyone else. And I've really enjoyed that side. It's almost slightly therapeutic to sit and make a wreath and you share that joy with someone else.
I love that you've leaned into the creative side, because so many of us don't do things we love or wish we could do because we're afraid of failing at it or not being good at it. But once you've gone through cancer, that kind of fear is gone. And I think it's important we talk about your treatment plan, because when you're living with uncertainty, knowing your options matters. Here's the thing. Recurrence can happen even when cancer hasn't spread to the lymph nodes. In the NATALY trial, consisting of patients with stage 2 or 3 HR positive, HER2 negative early breast cancer with a high risk of coming back, 91% of people taking KISQALI plus aromatase inhibitor were cancer-free, compared with 88% of people taking an AI alone at 3 years.
When my doctor told me there's no guarantee that my cancer wouldn't come back, I realized at that point I needed to do more. That's when we talked about KISQALI as something I can add to my hormone maintenance therapy. She told me KISQALI is a prescription medicine used in combination with an aromatase inhibitor to treat adults with HR positive, HER2 negative, stage 2 and 3 early breast cancer with a high risk of coming back. If you think KISQALI may be an option for you, talk to your doctor. Just keep talking. Keep asking the questions.
Nikki, thank you for being vulnerable and honest with us today. And thank you all for joining us today. Hear more stories of strength and fortitude by visiting voicesofmore.com. And please see important safety information at the end of this video.
What is KISQALI? KISQALI ribociclib is a prescription medicine used to treat adults with hormone receptor, HR positive, human epidermal growth factor, receptor 2, HER2 negative breast cancer, in combination with an aromatase inhibitor for stage 2 and 3 early breast cancer with a high risk of coming back. It has gotten worse or has spread to other parts of the body, advanced or metastatic breast cancer, in combination with an aromatase inhibitor as the first endocrine-based therapy, or fulvestrant as the first endocrine-based therapy, or following disease progression on endocrine therapy. It is not known if KISQALI is safe and effective in children. Important safety information. KISQALI may cause serious side effects, including lung problems. KISQALI may cause severe or life-threatening inflammation of the lungs during treatment that may lead to death. Tell your healthcare provider right away if you have any new or worsening symptoms, including trouble breathing or shortness of breath, cough with or without mucus, chest pain. Severe skin reactions. Tell your healthcare provider or get medical help right away if you get severe rash or rash that keeps getting worse, reddened skin, flu-like symptoms, skin pain or burning, blistering of the lips, eyes, or mouth, blisters on the skin or skin peeling, with or without fever. Heart rhythm problems, QT prolongation. KISQALI can cause a heart problem known as QT prolongation. This condition can cause an abnormal heartbeat and may lead to death. Your healthcare provider should check your heart and do blood tests before and during treatment with KISQALI. Tell your healthcare provider right away if you have a change in your heartbeat, a fast or irregular heartbeat, or if you feel dizzy or faint. Liver problems. KISQALI can cause serious liver problems. Your healthcare provider should do blood tests to check your liver before and during treatment with KISQALI. Tell your healthcare provider right away if you get any of the following signs and symptoms of liver problems: yellowing of your skin or the whites of your eyes, jaundice; dark or brown, tea-colored urine; feeling very tired; loss of appetite; pain on the upper right side of your stomach area, abdomen; bleeding or bruising more easily than normal; low white blood cell counts, neutropenia. Low white blood cell counts are very common during treatment with KISQALI and may result in infections that may be severe. Your healthcare provider should check your white blood cell counts before and during treatment with KISQALI. Tell your healthcare provider right away if you have signs and symptoms of low white blood cell counts or infections, such as fever and chills. Your healthcare provider may tell you to decrease your dose, temporarily stop, or completely stop taking KISQALI if you develop certain serious side effects during treatment with KISQALI. What should I tell my healthcare provider before taking KISQALI? Before you take KISQALI, tell your healthcare provider if you have any heart problems, including heart failure, irregular heartbeats, and QT prolongation, have ever had a heart attack, have a slow heartbeat, bradycardia, have high blood pressure that is not controlled, have decreased thyroid gland function, hypothyroidism, have problems with the amount of potassium, calcium, phosphorus, or magnesium in your blood, have fever, chills, or any other signs or symptoms of infection, have liver problems, have kidney problems, are pregnant or plan to become pregnant. KISQALI can harm your unborn baby. If you are able to become pregnant, your healthcare provider should do a pregnancy test before you start treatment with KISQALI. Females who are able to become pregnant and who take KISQALI should use effective birth control during treatment and for at least 3 weeks after the last dose of KISQALI. Talk to your healthcare provider about birth control methods that may be right for you during this time. If you become pregnant or think you are pregnant, tell your healthcare provider right away. Are breastfeeding or plan to breastfeed. It is not known if KISQALI passes into your breast milk. Do not breastfeed during treatment with KISQALI and for at least 3 weeks after the last dose of KISQALI. Tell your healthcare provider about all the medicines you take, including prescription and over-the-counter medicines, vitamins, and herbal supplements. KISQALI and other medicines may affect each other, causing side effects. Know the medicines you take. Keep a list of them to show your healthcare provider or pharmacist when you get a new medicine. What should I avoid while taking KISQALI? Avoid eating grapefruit and avoid drinking grapefruit juice during treatment with KISQALI, since these may increase the amount of KISQALI in your blood. The most common side effects of KISQALI in people with early breast cancer include decreased white blood cell counts, decreased red blood cell counts, increased liver function tests, infections, increased kidney function test, decreased platelet counts, nausea, headache, tiredness. The most common side effects of KISQALI in people with advanced or metastatic breast cancer include decreased white blood cell counts, decreased red blood cell counts, increased liver function tests, infections, nausea, increased kidney function test, tiredness, decreased platelet counts, diarrhea, vomiting, headache, constipation, hair loss, cough, rash, back pain, low blood sugar level. KISQALI may cause fertility problems in males, which may affect your ability to father a child. Talk to your healthcare provider if this is a concern for you. Tell your healthcare provider if you have any side effect that bothers you or that does not go away. These are not all the possible side effects of KISQALI. For more information, ask your healthcare provider or pharmacist. Call your doctor for medical advice about side effects. You are encouraged to report negative side effects of prescription drugs to the FDA. Visit www.fda.gov/medwatch or call 1-800-FDA-1088. Please see full prescribing information, including patient information, at KISQALI.com.